As I promised in the morning, so today is all about different countries presenting what is cooking in the books and sort of what could be the crazy ideas. So the first country to set us off down that road will be Denmark. To present the bold plans that the Danes have, we have a speaker who just prefers to go by the name Wang, just that. And what he does, he works in Danish Agency of Digitization and heading the international cooperation efforts there. That's something that I have asked all the speakers to tell me. What is their dream? What would they really like to have from ICT, from technology, from the future? And actually, he was very sort of straightforward with that. Let's not dream that much, let's do things. Execute. That's his dream. So show us the way.
Thank you very much. Yes, I'm not advocating for not continued dreaming, but actually we have dreamt so much during the last 15 to 20 years, but we have not realized so many of the dreams. And that is exactly what we are trying to do in Denmark at the moment, realizing our dreams that started in the early 1990s. First of all, I would like to thank Estonia for organizing this event. We have a unique opportunity here to share experiences, discuss approaches to digitizing our societies in the Nordic region. I think the countries present here today are among the front runners in the digital agenda in Europe. Having the opportunity to use each of our experiences as a common platform for developing novel ideas and visions for the coming years is seldom and should definitely be explored and exploited. And asking us to present a couple of crazy ideas is a certain opportunity to free us a little bit from the ties we're usually working under as civil servants, and also the ties from political strategic boundaries we are usually confined within. In that sense, I have to stress that the craziness of the ideas will be mine, so don't blame my country. But let me get back to the Danish case and challenges of Denmark. I want to share with you within the next around 40 minutes or so 3 main issues from the Danish context. The political and strategic challenges and our e-government strategy, and something that we have decided to build upon our e-government strategy, our new digital welfare strategy and action plan. And then I will get back to my crazy ideas, and you are to judge whether they're crazy enough. Sometimes, and also mentioned by Ms. Delves, we're challenged by the demographic challenge. And the reason for going a little bit into the background here is also that when we usually discuss e-government or digitization of the public sector, we too often very quickly focus on what and how to digitize services in the public sector. Sometimes we are so much into the gritty-nitty things, gritty-nitty details, that we sometimes totally forget the why. For Denmark and our current government, the main challenge for the public sector and its service delivery is, in a long-term perspective, is the demographic challenge. This development is shared by most OECD countries, and I think definitely also by the countries present here today. We are looking at a situation within the next 25 to 30 years where we will have 84% more senior citizens than today. We are still recovering from the financial and economic crisis from 2008 with limited budgets. We have a situation where, with low productivity compared to countries we are competing with internationally. With a foreseen change in demography and the current lifestyle of our population, we are experiencing more people with chronic diseases, putting additional pressure on our health system, as also just mentioned by your president. And last but not least, we have today a population that has grown up and got used to a welfare society with a broad provision of high-quality services provided by the public sector. The political and strategic challenge is therefore straightforward. How do we take up this challenge in a sustainable way that will preserve the Nordic welfare society model as we know it today? The Danish government acknowledges this overarching challenges and has given those challenges its full attention. Using ICT as a lever for public sector reforms has become a cornerstone in different government policies, giving public sector digitization a strong political mandate and a solid strategic platform from which to act. The Danish government growth plan goes towards 2020, operates with 3 reform tracks: improving framework conditions for businesses, increasing level of education and employment, and last but not least, reforms of the public sector and sustainable public finances. The third reform pillar is important and is envisaged to generate a revenue of 1.6 billion euros per year when fully implemented in 2020. Digitization of the public sector is expected to contribute to this target with around 670 billion euros, or more than 40% of the revenue. You can then ask, from where can we get these levels of savings? I think this slide says it all. We can save significantly by moving citizens and businesses to use online services only. And why should citizens who are perfectly capable of using online services not make use of them? Why waste taxpayers' money on expensive human resources at the front desk of public authorities if citizens are perfectly able of using digital service channels? As you can see from this analysis of transaction costs of public services, having citizens and businesses using e-services or self-service solutions online will save the public sector more than 60% of the cost per transaction compared to personal services or traditional letters received by public authorities. It is interesting to note, though, that making unstructured digital communication, like using emails, does not result in significant cost savings. You need to have fully structured, seamless, and integrated service deliveries. You can ask, is this actually possible? And my answer is, of course, yes. The Danish context is in place for abolishing expensive physical service delivery channels and relying on digital service provision alone. When we are a population of 5.6 million inhabitants. And the figures on this slide shows that Denmark is among the most mature e-government nations in the world. The Danes are already quite tech-savvy and use computers and the internet daily or several times a week. However, we do have around 10% of the population which need to be helped. This is a segment of the population consisting of mainly senior citizens and disabled persons. We are not letting this part of the population without help. Municipal citizen counters are ready to instruct citizens in how to access and use online public services. Family members can be given power of attorney electronically, so they can help a senior family member or disabled persons to access public services on their behalf. Denmark has since the early 1990s developed national information society strategies and action plans. From the start of the new millennium, Danish government began to focus sharply on common public sector digitization, and especially on efficiency and effectiveness and the realization of benefits. A number of action plans were developed in agreement between central government and the subnational government levels in order to strengthen progress as a coherent public sector. The strength of this collaboration has since 2001 resulted in a number of remarkable results. Already back in 2001, we gave citizens the right to send emails to public authorities, and those authorities were obliged to answer electronically. In 2004, we launched a public service security infrastructure using a common public sector free of charge digital signature to ensure secure communication between among public authorities themselves and between public authorities and citizens. Electronic communications was made mandatory between public authorities. The so-called E-days set specific dates from which all these milestones were to be met by all actors in the public sector. This approach has been powerful as a common incentive to move forward jointly together in the public sector. The Danish government e-government strategy and action plan is comprehensive and covers all major areas of public service delivery. There are 3 major areas of action currently under implementation. We want to eliminate completely all printed forms and letters from the communication between citizens, businesses, and public authorities. We want to focus our digitization efforts on the major public service sectors such as education, health, social services, and services in the labor market areas. We want to strengthen our effort in making the public sector back office coherent and integrated. That is infrastructure, data, legislation, and governance. I will, of course, not go through the more than 60 different initiatives under implementation towards 2015. However, I will give a few examples of key initiatives and their achievements. A key goal in our strategy is to have full digital communication between citizens and businesses and public authorities. More specifically, we want to have moved at least 80% of all written communications into the digital channels by 2015. We are, in other words, actually taking the next logical step of digital public service delivery, making the digital channels mandatory by law for all. However, we are not leaving the few citizens who, for different reasons, are not able or capable of using electronic means behind. They will be helped by the municipal citizen centers, as previously mentioned. Why do we see legislation as a game changer in public digitization? What we experienced until now is that we have had a situation with low incentives for public authorities to invest in good, user-friendly digital services. They were captured in a bad circle where low transaction volumes did not generate the necessary cost savings. By introducing legislation, more digital transactions are expected to be generated and have been generated, giving strong incentives to improve digital solutions and making them more user-friendly and easy to use. This again will diminish the use of the expensive service delivery channel and make it possible to abolish them. We conducted already back in 2001 to 2003 a comprehensive review of all Danish legislation in order to abolish legal barriers for digital communication. More than 10,000 laws, bylaws, and derived regulatory rules were reviewed. Legislation was changed if it required physical tokens, such as physical signature or physical document. In the years to come, we will ensure that legislation supports our digitization efforts. Besides making public services mandatory to use online by law, new legislation will remove any ambiguity on whether interaction with public authorities is to be done digitally or not. However, we still require people to show up in person to get formally married. On the other hand, if the couple regret their marriage, they can file for divorce online in minutes. The plan towards 2015 is to, as mentioned, to make 80% of written communication between public authorities and citizens, businesses, fully digital. Around 80 different services have been identified for mandatory online use. 9 services were by law made mandatory to use the 1st of December 2012. Last year, 29 services were made mandatory. This year, we have a law in Parliament at the moment, or a proposal for a law in Parliament for the moment, mandating 27 additional services to be used online, mandatory online. And more services will follow in 2015. We do not put these services mandatory online in blind. All services are screened with respect to user-friendliness and accessibility. This to ensure that all services made mandatory by law are fulfilling criteria for user-friendliness and accessibility. Just to give you a quick overview of the common Danish public sector infrastructure. To ensure secure and safe transmission of highly confidential private information and data, we have a security infrastructure supporting a common digital signature solution to be used by all citizens, businesses, and public authorities. We have one entry to all online public services, the Danish Citizens Portal for citizens and the Danish Business Portal for businesses. We also have a personalized sector portal for health issues, accessible directly or through the Danish Citizens Portal. For public payments, we have established a payment infrastructure obliging all citizens to have a NemKonto, or in English, easy account, allowing public authorities to transfer money using this account. We have recently established a brand new public authority centralizing major social benefits payment, including pensions, in Udbetaling Danmark or Payment Denmark. And we demand from providers to the public sector to be able to send e-invoices. This has actually been mandatory by law since 2005. And for communication, we have by law demanded all businesses and citizens that they are equipped with a digital letterbox, digital post. Letters, official letters from public authorities are delivered in the digital letterbox, and citizens and business can answer to these letters through the digital letterbox. For businesses, this became mandatory by law 1st of November last year. For citizens, this will become mandatory by 1st November this year. Let me give you just a few numbers on the digital letterbox, digital post. All companies registered in Denmark got such a letterbox by 1st November. We are talking about 654,000 registered companies. 80% of these companies are using or are technically ready to use the letterbox. 20% of the registered companies are inactive. A digital letterbox for citizens above the age of 14 is actually not new. A free offer has existed for some years, and already more than 1.3 million citizens of our population of 5.6 million have got a digital letterbox. And from the 1st of November this year, all citizens will be provided with a digital letterbox if they have not yet registered themselves for one. We expect that a total of 4.3 million citizens will, by that date, have got a digital letterbox. Digital signature, as also mentioned by the President, is a very important key component in the digital infrastructure. We have in practice today almost a full rollout of our second generation digital signature, NemID, or ECID in English. More than 4 million citizens have today a digital signature to access public services online. And as citizens can use the digital signature to access their e-banking solutions with all Danish banks and other private companies' web solutions, the usage of it by citizens are frequent and widespread. User surveys that we conduct frequently periodically show high satisfaction with the solution. But of course, when it occasionally is down due to malfunctions, it of course stirs a lot of public debate in Denmark. Very quickly about the e-invoicing. As I mentioned before, this was mandated by law in 2005. This slide shows the uptake in the first 4 years after the introduction of the invoicing. What you can see here on this chart is the number of issued e-invoices. In order to accommodate those providers to the public sector who didn't have a fully integrated accounting system which could issue e-invoices, we introduced a service which where paper-based invoices could be scanned and basic information of the invoices registered manually and then sent digitally to the public sector customer. The blue part shows the number of manually created e-invoices received from so-called read-in services. The green part shows the number of fully digitally created e-invoices received directly from providers. As you can see, the number of manually created e-invoices have gone down significantly over the period. However, today we see more or less a constant level of manually created e-invoices on the level around 10%, which is difficult to bring further down, mainly due to small independent providers with relatively low level of transactions. Another important project I would just mention very briefly is our basic data program. It addresses our basic registers, our key registers, the individuals, businesses, properties, addresses, roads and areas, maps and geography, and the relationship between them. We have actually a common public sector agreement about this project or this program. What is important is actually that all stakeholders are in agreement to move forward here. We reformed the way we managed our program and funded the agencies that previously were obliged to earn their living by selling data. Now they get a lump sum from the central government budget, and at the same time they were obliged to give free access to the non-sensitive data and give it free to the public. We are at the moment trying to build a more effective distribution mechanism of these non-sensitive data, a so-called data distributor, which will be opened early next year. You have, of course, done a business case analysis of this project. As you can see on this slide, we can see significant cost savings from the reform of our management of our basic data registers. When the program is fully implemented in 2020, we estimate yearly cost savings on the level of 33 million euros in the public sector and 66 million euros in the private sector. As mentioned in the beginning, we have nationally and internationally looked at e-government as the main focus for modernizing our public service delivery. And giving attention to e-government has been an important way to make our public administration and our service delivery efficient, effective, and long-term sustainable. We are today reaching a point where public administrations are on a development track to become integrated and efficient, offering progressively comprehensive and coherent services online. But is this enough in the coming years? We feel in Denmark that we need to go beyond traditional e-government and begin to give a stronger focus on frontline services in the major public service areas of health, education, and social services. The reason for us to focus sharply on service delivery in the welfare service areas is obvious: health, education, and social services. account for around 75% of all public spending in Denmark. This makes these 3 welfare service areas the main focus if you want to have the largest impact budgetary-wise and quality-wise. It's important to stress that we are not just doing this solely to save money. We do this because we sincerely think that smarter public services through extensive technology use can improve the quality of public services and make vulnerable segments of the population more independent of personal support and help. They are empowered to better take charge of their everyday life. I will now show you a small video. Could I have it played, please?
Det offentlige Danmark er i gang med en digital og teknologisk omstilling. Med digitalisering kan vi skabe mere sammenhæng i den offentlige velfærd og give borgerne bedre muligheder for aktivt at bidrage til velfærden.
Vi har her i Gribskov Kommune valgt at tilbyde borgerne skærmtræning, og skærmtræning går ud på, at borgeren har en skærm derhjemme og kan via internettet tilkobles os.
Hej Magdalena. Motivationen er måske nok lidt bedre, fordi det foregår herhjemme. Og det her, det er specielt designet til min sygdom.
Ved at vælge den her skærmtræning, så frigiver vi også en terapeutressource.
Jeg havde ikke selv computer eller noget. Så jeg var jo lidt spændt på, hvordan det gik, men jeg får altid god hjælp, hvis der er noget, jeg ikke kan klare.
Vi prøver jo at yde en service til borgerne, som skal fremme deres livskvalitet og gøre dem mere selvstændige.
Det DigEx går ud på, det er at digitalisere de skriftlige eksamener på universitetet. Og det betyder, at vi opsætter dem digitalt, prøverne, og vi beder de studerende om at få udleveret prøverne digitalt, og de afleverer digitalt, og vi bedømmer dem digitalt og arkiverer dem digitalt.
En fordel med digital eksamen, det er, at den indgår i den arbejdsproces, man i forvejen har som studerende, og at det giver mulighed for, at man kan få feedbacken digitalt, så man kan se, hvorfor man har fået den opgavebedømmelse, som man har fået, og man kan også lære noget af det i processen.
I forbindelse med det her projekt har vi oplevet, at vi har kunnet spare 76% af de studieadministrative arbejder omkring skriftlige eksamener. Og hertil kommer så også selve portoomkostningerne, som vi sparer 100%.
Vi tager ud hos borgeren og tager billeder af sår, og dem sender vi så til en database. Og der kan lægen så sidde inde på hospitalet og se de billeder og også læse de beskrivelser, vi har sendt med.
Fordelen ved, at det foregår i hjemmet, det er jo, at man ikke skal transporteres på hospitalet, eller man bare selv skal transportere sig derud.
Det betyder meget, at vi som sygeplejersker kommer meget tættere på hospitalet og får større viden, fordi vi jo direkte kan se ind i databasen, hvilke overvejelser der er gjort, og hvilken behandling eller undersøgelse der er sat i værk. Og det betyder også, at jeg har en dialog med lægen inde på hospitalet. Det havde jeg jo ikke før. Det giver jo en meget hurtigere og mere effektiv behandling, og det giver også en hurtig arbejdsgang for os ude i hjemmeplejen.
Så.
Regeringen, KL og danske regioner står bag en ny strategi for digital velfærd. Den skal sætte fart på brugen af teknologi og digitalisering i den offentlige service, så effektive digitale løsninger indgår naturligt i velfærden på sundheds-, social- og undervisningsområdet i 2020. Læs mere om strategiens initiativer og mål i publikationen Digital velfærd en lettere hverdag.
I think it's a good illustration of what we are trying to achieve with our new digital welfare strategy. And as you can see, we're not talking just about digitization as such, but we're talking about using of smart technologies and ICT. The strategy was launched in September last year. The strategy is a common public sector strategy. All levels of government have agreed on the strategy. We're talking about central government, regions, and municipalities. We want, with a broad and sweeping modernization of the public sector, do things smarter, better, and cheaper. The strategy establishes the basics and sets a direction for how we want to digitize the welfare areas. But we will accelerate the development in the years to come. And we are fully aware of that such a strategy with 24 initiatives are many, but they are very realistic and all parties have agreed on implementing it. And more will be screened, assessed, and added to the set of initiatives towards 2020. Just to give you a quick overview of the areas that the strategy covers. Telemedicine, such as implementation of national good practices. Collaboration within the health sector, such as online booking with hospitals, common medical registration cards, video interpretation and conferences. Welfare technology in elderly care, using of lifting devices, automatic toilets, assistive eating devices. Digital case handling, speech recognition, knowledge sharing on efficient good practices, data sharing. Digital learning and training, such as digital teaching materials that we just saw, tools and exams. Digital collaboration within education, such as common user portal for primary and lower secondary schools. Digital education folder with graduation papers. Increased quality through data sharing. And of course, the foundation to make all this happen, we need to have the prerequisites in place, broadband capacity, the launching of a mobile digital signature this year in May, common security standards, digital competencies and skills with the different actors. Basically, we've set up a framework with the aim of faster dissemination of documented, efficient, and effective solutions. The solutions have to reduce public spending. That's the trigger point for us. And to the degree possible, improve quality of life for citizens and improve the work environment for public employees. We must produce concrete knowledge of what works before we disseminate specific solutions. We cannot afford to disseminate something where the effects are unknown regarding the quality of service, the effects for the citizens, and the public budgets. Also, in areas where we have many promising results, we need to know the concrete consequences. As an example, as also you saw in the video, the monitoring of patients, what are the consequences for patients' health, the municipal care, the hospitals, the GPs. We're crossing across different responsibilities between different levels of government here. We want to achieve a kind of catch-up effect. The strategy has established ambitious, concrete goals for digitization of the welfare areas in the years to come. That means that we have goals for when we must know the effect of specific solutions. When we have the necessary knowledge, we disseminate fast. Another example, as we also saw in the video, the health monitoring of patients with chronic diseases. We currently have 2 large-scale projects involving more than 3,500 patients. If the results are positive, we will disseminate home monitoring of COPD patients, that is, patients with chronic lung diseases, within 3 years, all over Denmark. I think it is well known what is meant by digital by default when talking about public sector digitization. I think most countries understand the notion as digital as the first choice. In Denmark, we usually mean, as I also mentioned, digital will become the only choice by law. We are not yet there with our welfare services. But the basic thinking behind the notion of digital by default is the same. We want to replace expensive face-to-face services with digitally supported or technology-supported services that work. When talking about digital welfare, we mean that digital should be the first choice by the public sector. We're not leaving people behind here either. Those that need help to start using new solutions will get it. Those who cannot use the new digital solution should continue to get the public service they are entitled to in other ways. This is just to show you what has been agreed upon to disseminate nationally. We are talking about assistance with lifting of elderlies in elderly care homes or in the elderly's private homes. Using lifting devices will save significantly on the manpower side. Instead of having 2 home nurses or social workers lifting a person, an elderly, out of bed, into bed, only 1 is needed using a lifting device. The business case shows yearly savings of 47 million euros when fully implemented nationally in 2017. The return on investment of shower toilets is, depending on the specific scenarios and the state of health of a person, is actually from 8 weeks to 3 years. An extensive use of aid and appliances, including public sector staff training, shows a business case with cost-saving potentials on the level of 20 million euros per year. I will actually not go into this case that you saw on the video, but perhaps just show you the numbers. The business case regarding our foot ulcer care project that you saw demonstrated on the video is quite convincing. With 20,000 patients with diabetic foot ulcers and 20,000 patients with ulcers due to bad vein functions, we're talking about a significant commitment of resources in the public sector to help these patient segments. Changing the division of work between medical doctors and home nurses and supporting their new work process with simple digital tools, our business case shows yearly cost-saving potentials of 45 million euros when fully nationally implemented by 2017, from an initial investment of only 4 million euros. This has, in our large-scale project, proved a better everyday life for foot ulcer patients, giving home nurses more interesting work and saved a lot of time of specialized doctors, medical doctors at the hospitals, allowing them to focus on the most complicated cases instead. Okay, the crazy ideas. We've been given this challenge of the 3 crazy ideas, which is crazy already. And looking at what we are doing in Denmark might, by many outside my country, look like something crazy to do. The points I've tried to stress during my presentation of the Danish approach to digital society are, I must admit, far-reaching in an international setting. But as I've tried to argue from Danish perspective, what we have done and are in the process of doing are necessary next steps in public sector digitization. So when I suggest doing what the Danes have done with regards to making the use of online public services mandatory by law is my bit on the first crazy idea. Another crazy idea is to drive digitization and the change of business processes in the public and the private sector by making e-invoicing mandatory. This will, in our experience, be a potent driver towards full digital business processes in the public sector as well as in the private sector. And my last bit on a crazy Danish idea is to go beyond e-government and embrace digital welfare solutions in frontline service provision. Making change that can be felt and experienced by citizens through the use of smart technologies, and further digitization should become the focus in the coming years. What I've done here is giving you a very quick overview and insight into what we are doing when we're saying that we are moving beyond traditional e-government. Our strategy for digital welfare builds on top of our national e-government strategy. What is needed today is to accelerate public sector modernization and have the political and managerial courage to take the necessary decisions to reform our public sector in a way that makes everyday life of citizens and businesses easier and less costly for governments. Only in that way will we actually be able to square the circle and address the long-term challenge of an aging society with a decreasing workforce and decreasing budgets. Thank you very much.
So, crazy enough? We got some yeses. All right. Well, I think you have presented us a sort of overview of a very ambitious program, how Denmark is actually quite completely changing and rebuilding the government, but not just the government, but actually changing the lives of people, right? So what I'll do to get us back on schedule with time, we can take 2-3 questions. I'll ask you to be brief with answers. And so if anybody wants to ask questions, can I just ask you to stand up and a microphone will be brought to you. So, what would you like to know, and would you like to challenge any of the crazy ideas that were proposed?
The crazy Dane will be here the whole day, so you can also address me in intermissions.
He will take all the blame, right? So, does anybody want to ask something? So think of it. I'll ask the first one. So, the plan to make all the services mandatory to be used digitally, how has that been perceived by the public and especially in the citizens? You talked about how you offer assistance to the ones who cannot use things digitally, but still, how has been sort of the perception, and what steps have you taken to ensure that people buy into this?
Well, generally speaking, we in the government system were surprised that it didn't make a larger fuss as in public debates. Of course, we have debates or angry citizens calling us. We have, especially the elder senior citizen segments, are very worried. We actually, the municipality of Odense has pushed the deadline for mandatory use of online services by starting 1st of April instead of 1st of November. That has created a lot of insecurity, but in general, actually, we got quite positive feedback from the citizens in general, and actually also from the senior citizens. They suddenly discover that learning to use a computer, accessing public services, is actually opening up a new world for them. They suddenly discover, oh, I can follow my grandchildren on Facebook. Mm-hmm. And there are actually many elderly citizens who are very enthusiastic. We have, of course, also elderly citizens who are very worried.
Yep.
But by having a double strategy of having the citizens council in the municipality open and ready to help those elderly citizens and other citizens who, by tradition, actually just want to go down to the citizens' municipality instead of using online, the staff there will not, as the first thing, do it for you. They actually will take your hand, go to one of the computers in the Citizen Center, and teach you how to use it so you don't need to come here again.
Right.
So there is a setup by the municipalities to ensure that we catch those who are insecure about the new way of addressing or accessing public services. And at the same time, we work closely with the NGOs representing the elderly citizen segment and disabled persons. And actually, one thing that was quite interesting was that the disabled persons associations actually said to us, you have to accelerate the digitization, because if the disabled persons, such as visual impaired, they need to have the digitized services so they can actually use their assistive devices to help them. So of course, we still have the critical, but surprisingly also many positive and constructive feedback from our population.
So contrary to popular belief, the fact that you're actually forcing the people makes them happy. Okay. Can we get the question? I'm getting impatient with your crowd, okay? Can we get at least one question? Yes.
I have again a question. I recall Denmark was one of the countries who was the first one to bring the kind of user-centric approach to the public sector service design. And you created personas, I think, for the design nationwide use for the public services. So what kind of advice would you give to for this day and for the digital agendas? How do we bring that experience that you've had with the user-centric approach to, like, when we are deploying these digital services and designing them?
We have a very elaborated procedure for putting public services onto the mandatory arena. And that includes a quite comprehensive checklist of, I think, 26 different criteria to be fulfilled, including a very close dialogue with focus groups and through a very close cooperation with the private sector providers who actually built the different systems. And actually, the dialogue with the private sector providers are quite intensive due to the feedback they get from the different user segments of the different services. But definitely, much attention needs to be on the user friendliness, the accessibility issues, fulfilling the international standards in the area. But one issue which actually triggers me even more is the use of public services in a live situation, meaning when you as a student need to access different types of services crossing over different authorities. There, Denmark still has something to do in order to make these user journeys more easier to use. As I think most countries started out by looking at, or each authority, I think, start out by looking at the service that I am providing has to be online and how can we make that better. But actually, we're at the level where where what we have demanded from our authorities when we demand to have services put on the mandatory part of our service delivery, we have discovered that the consecutive use in specific user situations is even as important as the focus on single services.
All right. You know, when you came on stage, we were actually supposed to have you come to the stage with a national song. So now you get to leave with that. But ladies and gentlemen, big hand for Denmark. Thank you.